Dr. Jennifer Lincoln. I'm a board-certified OBGYN from Portland, Oregon, a social media educator. I've got about 3 million followers on social, which is not something I thought I would be standing in front of a group of people talking about as somebody going to medical school, and the executive director of a health education nonprofit, Mayday Health, which I will talk more about here. And the name of my talk is Swipe Right to Learn How, and after I submitted that, I realized swipe right, like this is not a talk about Tinder. I have no experience with that whatsoever, not that there's anything wrong with that, but this could be called Swipe Right to Learn How, or read the caption, or basically, how can we use this tool that we have in our pocket? I imagine most of you have one, because we're attached to it at the hip, myself as well. Basically, how can we use tools like technology, like our phones, to take back our power in a country where maybe we didn't get what we needed when it comes to health education? I feel like we're hearing a lot about that today, and if you live here, you know that, right? Maybe your parents didn't teach you how your bodies worked because nobody taught them. Maybe your schools didn't teach you how your bodies worked because it was abstinence-only education. Is there anybody here who's like a survivor of abstinence-only? Yes, recovering all-girl Catholic school, because that was me. Just maybe why I'm a vagina doctor now, because it's all I do. Or maybe it's our own healthcare providers, and as one I can say that you went in and you try to get what you need and you leave having more questions than answers, or you just feel like you're not being heard. Or maybe it's our politicians who are now telling us what we can and can't have access to because heaven forbid we know too much about ourselves. So my point here is that we can use our phones, we can use technology not to fix everything, because I'm not that simplistic, but for sure we have a tool out there. Let's fucking use it to resist, to educate, to take our power back. My husband's gonna be I was like, I won't curse, but we're in the great state of Texas where there's a lot of things happening right now that aren't so great in the great state of Texas for people who live here. And as somebody from Oregon, I can see the disparities across the borders, and we think our rights have no borders, our access to how we control our own bodies should have no borders, and yet here we are. So how do we take back that power? How do we know the things that they don't want you to know? So that's what we're going to talk about today in just, like 10 quick minutes. So when I look at this map of the United States, I've got 2 kids and they, study the states, and they're like, oh yeah, that's America. And maybe that's what people want us to think, like, oh, this is America, right? One government, one constitution, one set of rights. That's a bunch of lies, right? Like, let's be real. Not everybody has the same experience because of where you live based on your zip code. Let's talk about that. Let's talk about how much you were invested in as a child in your public health education in your schools based on where you lived. A very different amount of money was invested in you. In New York State, $25,000 per student is spent per year on education. That's the highest. The lowest is Utah, $8,000. Now, I'm not saying that there's one right or wrong number and that spending more always means more, but I have a really hard time believing that that's that amount of range of how much we spend on our kids in education, and that these kids are getting the same thing that they need, right? And let's talk about how it's linked to property taxes. Should how much is spent on your child or on you when you were educated in school be linked to property taxes? That doesn't make a whole lot of sense. My favorite subject, it's what I talk about on my social media a lot, is education, or rather the lack thereof. Sex education is only mandated in 25 states and the District of Columbia in the great United States. So the other half, they're just like, good luck, just don't do it. Like, we just don't teach our kids, right? And that's how I grew up. I was told to pray, and if I had sex, I would get gonorrhea, chlamydia, get pregnant, and die and go to hell. Thank you, Sister Claire. Again, that's why I'm here today. What's even worse is that out of the states that are mandated, so remember I told you 25 states sex ed is mandated, in only 17 of those states does it need to be accurate. So I don't know what's worse, if you either get told nothing or if what you get told is a bunch of lies. And there are a lot of states that are continuing to say we do sex education, but they're telling you miseducation or misinformation or disinformation. So how are my patients, or how are you supposed to get out there and know how to keep yourself safe and do what you need to do and know what's normal and what's not normal and how to advocate for yourself when you've not been given the language? This is what we call maternity care deserts. Everything that's in red, and you're gonna start to see a pattern of where these things are. Everything that's red is a maternity care desert. This is where there are counties that have no access to maternity health care. So they don't have a labor and delivery unit in their hospital that is staffed with an obstetrician or a midwife, or they have too little staffing. So these are people who have to travel to get care. 36% of our counties in the United States are qualified as maternity care deserts, 1 in 3. That affects 6.9 million women of reproductive age every year, and every year, 1 in 8 babies are born in a maternity care desert. That's 500,000 babies every year. You can't tell me that everywhere in America, kids all have the same start and the same access to things. Because if you need obstetric care and your closest obstetric provider is 2 hours away, or you need high-risk care and that care is 4 hours away, you're not getting the same level of care, right? And so how are we gonna close this gap? And then we can talk about preterm birth. Are you seeing a pattern here where things tend to be the worst? Preterm birth rates, so these are babies that are born early that have higher issues in terms of medical risks, long-term risks. They end up in the hospital for a long time. It varies a lot based on where you live. The worst state, Mississippi, 14.2% of all births are preterm. The best state, Vermont, 7.6%. I'm in Oregon, we are number 2. I am working really hard to get to be number 1. The point is that we can't say, again, that where you're born, your zip code affects a lot even before you've exited the uterus. This, unfortunately, gets worse when we talk about maternal mortality, which, P.S., we have an enormous crisis in this country, and it's only getting worse. And when you break it down further by race and ethnicity, it's even worse, not based on the actual race and the skin color, but based on the racism that we see within the country that we live, as well as factors such as marginalization, lack of access to health care. So Louisiana is the big winner here, 58 per 100,000 maternal mortality rate. And again, you can see the vast majority of these states are in states where they now don't have access to abortion care. So it's not gonna get better, right? When people aren't prepared to have babies and then they're forced to because they live in a state where they can't get the care they need. Like, how do you think that's gonna play out? But this is the thing that I really wanna focus on, and unless you've been on I don't know where you've been, I'd like to go to that place, but if you don't know what that map is, this is now showing in the United States our current abortion bans, where either abortion care is banned or severely restricted, and it's only getting worse, right? Like they just submitted a bill in Florida to now make it a 6-week ban. And people say, oh, well, let's not talk about politics. Cool, I'll stop talking about it when they get out of my exam room. The bottom line is that you can see in the same states where maternal mortality is the worst, where we're spending the least on kids and education, and so much more, these are now the states where people don't have access to the reproductive health care that the UN, we recognize it as a human rights violation. So back to that map, which is cute and adorable, but it's not the whole story. So how do we fight back? And again, I am not so simplistic to say, well, you just Google everything and it's better. Like, no, obviously there's a lot of garbage out there. But as a social media educator, somebody who educates about this stuff every day, I see what's out there, I see the misinformation, and I also see the ability to help. And so what I'm saying when I create content is I think, how can I reach that 16-year-old in Texas who's terrified? Or that 25-year-old in Mississippi who doesn't have any, obstetric provider nearby? Not because I'm trying to give out, personalized medical advice, but how can I empower people to get content, get information, to feel like they can speak up, know that it can be better, that if their doctor's not listening to them, that's not okay. And how can we use this as a tool to educate, empower, and take back the things that are continuing to be legislated away? So I want to show you an example of how some technology is already doing this. I'm not making any money from any of these companies. I just think they're cool, and I know the people who made them, and so just as an example. So you have to talk to your 12-year-old daughter about puberty, and nobody's ever talked to you about it other than, remember, don't have sex, get pregnant, don't die, and get chlamydia, like Sister Claire taught me. Well, there's websites and things out there now that you can say, okay, I need to talk about it because we're in Kentucky and my daughter doesn't get sex ed. This is an example of a website called Girlology. They also have Guyology and Uology, which I think is more gender inclusive and more appropriate. But it's two doctors who have a whole program where you can go through this synchronously or asynchronously with your child. It's a way to close the gap. It's not the answer, but it's a way to get the information that you need in the meantime. I don't know if any of you have used mail order birth control. I wish that was around when I needed birth control in college and I had to go to the county clinic and I was treated like I was coming to get, I was just basically, trust me, they were like, look at you, here's your pills, And so you can order things like birth control pill, Plan B, and yes, abortion pills online in a way that is safe, confidential, and these are legit pharmacies. And my personal thing that drives me nuts is healthcare providers that try to hold contraception hostage. You have to come in for your pelvic exam in order to get your birth control. No, you don't. No, that is a very old school way of thinking. So why are we holding it hostage? So things like Pill Club or Nurx, and there's a ton of other ones out there. I just picked two. I'm not endorsing any of these. The point is they exist. They're a way to say, you're not gonna give me my birth control? Cool, I don't need you. I'm gonna go get it from the online pharmacy, and maybe one day it'll actually be over the counter. That's like my weird YouTube face, because you gotta make the stupid faces in order to get people to click. But another thing that I do is if you have the ability or the platform, you can create content to address the things that are out there. I'm that person who on social media, I use the words vagina, clitoris, orgasm, nipple, scrotum, anus, testicles, like all of it, like all the correct words, because I'm so sick and tired of hearing the incorrect words, which mean shame and stigma. And so I create that content as a way to try to uplift these things, normalize these things, so that when somebody's scrolling through TikTok, because TikTok is the #1 Google engine now for Gen Z, by the way, they don't go to Google, they go to TikTok. Rather than hear some shameful word for something, they're like, oh yeah, I can say vagina and it's not dirty, just like we say penis all the time and it's fine. And I'm not saying you have to do that, but if you have the ability, if you have a platform, if you have a voice or a position of power, what if you used it? What if you used it to either make content or share it, or if you see garbage content out there, which there's like a little bit, right? Like, don't amplify it. Don't follow these people. Report for misinformation. I love a good misinformation report. And let's just talk about this tool in our back pocket that is literally a tool of resistance, right? Mahsa Amini, why do women like freedom in Iran? Why is that such a movement? It's because young people are showing what's happening in their country every day and how they're fighting back. These brave teenagers and women cutting off their hair. This is an amazing tool that we can use social media as a way to resist and to fight back, or to show what exactly is going on, the horrors of these abortion bans, exactly what's happening. Tell the stories, put it out there, amplify it when you see it. The only way people really understand is through storytelling, and this is a way to use that platform. I'm going to share my nonprofit. I'm not here to sell you anything because we don't sell anything. We just give out information just as an example. If somebody needs help, a way that you can help them. So Mayday Health was a website that was founded the day Roe fell. I was not part of it then. But basically they said, holy crap, our country's falling apart. What can we do when only 1 in 10 Americans know that abortion pills exist, and even with bans, you can still access them in all 50 states. There's ways around it. Well, the beauty of free speech is that we can tell anybody anything that's true, and it's protected by free speech. So that's why I can stand here in Texas and tell you that you can go to this website and figure out how to get abortion pills, and I can wear a shirt that tells you the regimen, and that's free speech. And so this is an example of a website that, this is what we do. We tell people how to do it safely, how to digitally protect themselves, how to not leave a digital trail, which is unfortunately important, how to get free legal advice, and how to go to websites that even if next Wednesday mifepristone has the FDA ban revoked, which it may happen, how to still get them from international sites. And why does it matter? Because they don't want you to know this. Why do you think that in places like Texas they're putting in bills where they want to restrict what websites you can go to? Because once you have education in your hands, nobody can take that away from you. And if that's one thing I can tell you today is whether or not you agree with all these things, it's important to know how to take care of yourself, and knowing how to be in control of your reproductive health care, whether they want you to or not, is very important, because it's basic health care, and that's something that maybe you need to know or maybe a friend needs to know. So not only do I think, and this is just more of the website, I'm just gonna we can just cruise through it. And I made another website too that tells you how to do the same thing with birth control and emergency contraception. But the point is that, and does anybody know who these women are? Yeah, the Janes. Has anybody heard of the Janes? Yeah, so for those of you who haven't, and that's okay, these are like college-age women, right? Young women. These were the Jane Collective, who back when they saw the horrors of what was happening when abortion wasn't accessible before Roe happened in the late 1960s in Illinois, they said, no way. Their founder, Heather Booth, had to help her friend get an illegal abortion, an unsafe abortion. And when she had to get her through that process, she said, I can make this better, I can help. So she formed this collection, the Janes, where they put out information, pregnant, call Jane. And one of them would pick up and would help get these women the safe abortion that they needed. And after they saw they were helping women get abortions, they thought, that's not that hard, we can do them. And actually, it's not that hard. In the span of 1969 to 1973, they helped women get 11,000 safe, illegal, but safe abortions. They saved lives. These women today would have killed for a tool like this. They had to rely on pasting up, phone numbers, hoping they wouldn't get caught. Here they kind of did, but it turned out well. They would have loved a tool like this that is so liberating, where they could take it into their own hands and get this information out there. And that's what I want to say to you today, is not only can you get information, whether it's about abortion or birth control or safe sex or HPV or anything at all, cancer, not only can you, but you need to if you're in a position of power, because so many people are trying to silence us and take away our voices. And so I want to encourage you, To think about this tool not just as like the, oh my God, trust me, I love a good TikTok meme and a dog video and a cat video, but I also love it as a power of resistance, because human rights have no borders, and your access to care should not depend on your zip code. And so if I can light a little fire of activism under you, and know that it's scary, trust me, we put ourselves out there, but if you're in a position where you can do that, I would ask that you would. And the poet June Jordan said, we are the ones we've been waiting for. They don't want you to know this. They hate that we have this tool. So let's use it, and let's fight back. That's it.